But let's go ahead and get started. So how do you get the help that you need to take care of the symptoms that you have? One of the first things you need is a great medical team. But it also involves reasonable expectations. It involves collecting data and having a goal. Preparing an agenda for your appointments. Communicating effectively with your doctor. Teaching that doctor about EDS, of course, because let's face it, most of the doctors don't know what it is. And then understanding what the roles are for different parts of our medical system. These are the ideas that we're going to go through today. So what is an EDS medical team? There really is not one doctor or one type of specialty that's able to investigate all the symptoms that you may have and provide treatment options for those symptoms. So with how the world of medicine has become more and more specialized, we really need to build our own medical teams with specialists who are able to address the types of symptoms we each have. Our medical teams are going to look different from each other's because we can have different symptoms one person to the next. So it's up to you to look at what types of symptoms you have and then match what types of specialists you need for your medical team. But with any team, you need a captain or a leader, right? You are the team captain. You are the most important person on your medical team. You know your body the best. And it's up to you to manage your team and to lead your team. Other members of your medical team, though, will include your primary care provider. Primary care providers are excellent at helping you manage your general health care. Just because we have EDS, we also have all of the health needs that any human has. We still need to go for checkups and all the rest. Your PCP is the person that can help you with that. But then you're going to need specialists who specialize in what your needs are. If you have GI symptoms, you may want to see a GI specialist or a GI motility specialist. If you have joint issues, boy, that world of medicine has become so specialized. You may have an orthopedic specialist for your shoulder, another one for your knee, and another one for your feet and ankles. But there might be other providers on your medical team as well. A lot of us see physical therapists frequently. They're part of your team. Psychologists can be very helpful on your medical team. Your pharmacist can be a very important person on your medical team. So think of your team as more than just your doctors. There are a lot of different specialists important to the care that you get. What kind of specialist do you need? That can be confusing. This website is a really good one for providing a brief description of what each specialist is. So if you are not real savvy about what each specialty does, I encourage you to start there. It can help you figure out what specialist you need for the types of symptoms you have. How often do you see the members of your medical team? Well, your PCP you may see once a year, or maybe they need to see you every 6 months for blood work. Some specialists, like let's say your physical therapist, you might see once or twice a week. Your geneticist you may see just for diagnosis and never see him again, or you may see them once a year to check back in. Another specialist will be as needed. You may see them for a period of time and then not see them again for several years. You will need to communicate with your team, and there's different ways you can do that. A lot of practices now have patient portals, and that's how a lot of us are finding success communicating with our medical teams. But some doctors are comfortable giving you their email address or making appointments and communicating with them during that time. But because our doctors usually don't work in the same medical practice, it's still up to us to share what is going on with our medical care, what decisions other doctors are making with each doctor that we see. So what makes a good doctor? How are you going to know it's a good doctor for your medical team? Well, you want a doctor who's able to connect the dots. They may not be a Dr. House, but you want them to at least have a little bit of good thinking skills. You want someone who's interested in learning new things, especially if EDS is new to them. We want them to learn about EDS. You want somebody who treats you as an equal partner in your care, who communicates well with you and wants to work with you. He talks about why they're making the decisions that they are making, but also listens to you when you're describing what your goals are or what your symptoms are causing you to feel like. Again, a good problem solver. That's what we want out of our doctors. But we also have to be good patients. A good patient takes charge of their health and is an active participant in it. When you go to the doctor's office and you just say, oh, I hurt, what is the doctor to do with us? They don't know what it's like to be in our bodies, so they don't know what we're trying to tell them. What hurts? When does it hurt? What are you doing when it hurts? What are you doing to try to make it stop hurting, and how is that working for you? You need to be a good communicator when you're working with your doctor. You want to be able to come on time and be organized, be willing to try treatment options, and be honest with your doctor. And that good doctor-patient relationship is collaborative. You communicate well, you respect each other. You know that you are the expert of your body. But you understand that the doctor is the expert of their field of medicine. You may not always agree with your doctor, but if you can respect each other, you can have good discussions and figure out a plan for your health. But where do you find these good doctors? Because I know that's a challenge a lot of us have. Family members, friends are great sources. You can ask them, who do you like? Who do you see? EDS organizations are also a good resource, as are local support groups. Honestly, where I think you can find the best doctors is contacting your local EDS support group, because the EDSers who live where you do have seen a lot of good doctors, and ones who maybe aren't as good, and are often willing to share that information with others who live near them. On the Ehlers-Danlos Society's website, we have a listing of all of the EDS support groups that we know about. You can get on that list, look for the one that's closest to you, and contact them and ask for any doctor recommendations you might need. You do need to do research even after you get the recommendation to know, is this a good doctor for you? A good question is, do they take your insurance? What hospitals do they use? Do they have appointment times when you think you'll need to use them? Are they accessible on weekends or at nights if that's when you need to see the doctor? When you have a good choice and you think you found a doctor you want on your medical team, go ahead and set up that first appointment. You can consider this to be an interview appointment. You're interviewing them to see if they'll be a good fit for your medical team. You want to ascertain, are they willing to learn about EDS if they don't already know about it? How do you think they're communicating with you? Are they showing an interest in your care and helping you feel the best that you can? If the answer is no, they may not be a good fit for your team. These are some questions that you might want to ask during the interview appointment. Some of these questions, though, can be answered on the doctor's website or by asking the front desk. So they don't all have to be asked of the doctor. But it's important to know, what is the doctor's role? And that's something that you're deciding. What role do you want this doctor to fill? Do you want this doctor to investigate symptoms that you have? Are you wanting this doctor to help fill out paperwork because you're filing for disability benefits? Are you just wanting this doctor to be willing to monitor your aorta year after year after year? What role do you want this doctor to do? Then, when you are at that appointment, you want to ask directly, are they willing to fill that role? For instance, if I were to say, are you willing to work with my chronic health condition, Ehlers-Danlos syndrome, to help me accomplish my goals of sleeping better and having less pain? The doctor has the choice to say, yes, I'm willing to fill that role. Or they may say, no, I'm sorry, I'm not willing. Then you can ask them, what role are you willing to fill? When they tell you, then you have a decision to make. Are you willing to accept this doctor with the role they're willing to fill? Or is that not going to be helpful for your care? You also want to share with the doctor what role you're willing to fill. Are you willing to try any of the treatment options offered after, of course, you research them and consider them? Are you willing to be an active participant in your care? Are you willing to understand the doctor's going to try their best, but they really probably can't fix everything? And then it's decision time. Is this doctor going to be a good fit for your medical team? Are you going to be able to work with him or her? Are they going to be an asset? Once you decide the doctor is a good fit for your medical team, you want to discuss with the doctor your long-term goals. The goals are going to be different for all of us. It's up to you what your goals are. Maybe you have challenges at home or work you really need help with. Or your goal is to take fewer medications or to have fewer dislocations, to eat with less pain. Whatever your long-term goal is, that's what you want to discuss with the doctor. But if we want effective medical appointments, we need to do the work and prepare for them. This is how we get the care that we need. One part of that is having reasonable expectations. If I go to my doctor and say, I want to be pain-free, it's not going to go over well. I want you to cure my EDS. That's not a reasonable expectation. I want you to run hundreds of tests and be like Dr. House and figure out all of the reasons why I have my symptoms. That would be great, but that's probably not a reasonable expectation. But what about having a goal of having your pain low enough to be functional? Or having an expectation that there's no cure, but there are ways to better manage your symptoms and to feel better and function better. Having reasonable expectations is one way we can get the care that we need and work better with our doctors. Whatever your goals are, that's going to dictate what's discussed at each appointment. And that is what your doctor and you are trying to accomplish. Your goal is how you're going to direct your medical care. And that goal is decided by you. So when you create your appointment goal, when you create your goal, you want to think about what you want to have happen at this appointment and what you want to leave with. What do you want this doctor to do? Are there images or tests that you're looking for? Are you wanting to trial a new medication? Maybe you want a referral to a specialist, or you want paperwork filled out. Whatever goal you decide is what your appointment is going to be about. When you have your goal, start collecting data to support what options you're wanting. For instance, if you want a new medication to try, start collecting data that would support why you need this medication. As an example. This is also how your doctor is going to help see patterns in your symptoms, for you to see those patterns. It's going to also justify the need for testing, which, let's face it, a lot of insurance companies fight us on and need that justification for why they need to cover it. Collecting data does take time, but it helps you get the care that you need. Why should you track your symptoms? Why should you collect this data? Well, the Pew Research Center did a study about 4 years ago. 46% say this activity changed their approach to maintaining their health. 40% led them to asking the doctor new questions or getting second opinions. 34% say it affected a decision about treatment. This changes how you get the care that you need, and it improves the care that you get. When you're collecting data, you and your doctor need to know what symptoms do you have. What makes your symptoms flare? What's the trigger? What have you tried to treat those symptoms, and how has that worked? Looking at the triggers for your symptoms, a lot of times we don't know what the trigger is. And that's one of the reasons, too, to collect data. We need to record everything from the weather, what you've ate, what activities you've been doing, how you slept the night before, any pieces of information that might be a clue as to why you're having this symptom or why it gets worse when it does. You can do it the old-fashioned way with charts and diaries and journals or Excel sheets, or you can use apps to do it. You want to record as much as you can about your symptoms. Everything from what causes it to what you're doing about it and how that's working for you. This is a sample of a pain diary. You can either hand draw your own, or there's many on the internet for all kinds of different symptoms. You want something that both collects the information for when you have these symptoms and what you do about them and how that works. You can translate that information into a graph if you'd like. While this is a little extra step and a little extra time, in my experience, this picture at a glance at a doctor's appointment helps doctors immensely see what it is that you're talking about and why you need what it is you're asking for. This is a line graph. Of course, bar graphs work well for this too. If you're a high-tech kind of person, You can use apps to track your symptoms or to record what you do about your symptoms and how it's working for you. Whether you have an Apple or an Android, there are lots of apps out there. These are just examples of some of the main ones. For each appointment you have, though, you do need to also develop an appointment agenda. This appointment agenda will have your goal on it, what medications you're taking currently, and any relevant history, like if you've had a surgery recently or anything like that. A timeline of your symptoms. When did they start? How long have they been going on? What you've tried, again, how is that working? It's obviously not working well or you wouldn't be at that doctor appointment. But by listing what you've already tried, that helps the doctor know not to try that again, and you can move on to other options. If it's something that you can collect samples for or take a picture of because it only happens sometimes and you know it's not going to happen during your doctor's appointment, those are good things to bring to. Or even a short video, if that's helpful. This is an example of an appointment agenda. You would want to have your date, what doctor you're seeing, what information they may be collecting at that appointment so you can keep it for your records too. And you can see the different types of information that you have. When you make up this agenda before your appointment, you also want to include questions that you're going to ask at that appointment. But you want to leave space for information that you're going to get at that appointment. And go ahead and make 2 copies, one for yourself and one for your doctor. When you're at the doctor appointment and getting that information, you can fill in the blanks, like what your weight was, or your BP, your blood pressure, what notes that you want to take, what was discussed at the appointment. And even when you came to the appointment with questions, that appointment might cause you to have even more questions that you want to write down. The doctor's going to put this agenda in your medical records, and you can keep your copy for your records. But if you have any occasion down the line, for instance, filing for disability benefits, this is a perfect record of everything that's been going on for all the time you've been seeing this doctor. But of course, collecting all this data and making these appointment agendas means you have lots of papers flying around that you need to keep organized. There's a lot of different ways that you can keep organized. For instance, you can have an accordion file where you keep it, a file folder, a box, a 3-ring binder. Think about what works best for you, for your life. Since we're in 2017, there's a lot of high-tech ways to stay organized as well, if you don't want to do it the old-fashioned way like the accordion files. My Medical is a great app for staying organized. But I included one here that is not for keeping organized, but still is a great resource. Lonesome Doc. I love using this one. It allows you to order the full article to abstracts that you see in PubMed. It's provided by the NIH. When we need to educate our doctors about EDS, it's helpful to back up what we're saying with a medical research article, right? This is a great place to get those articles. If you're having an appointment, let's say about, let's have an appointment about GI symptoms. You can look on PubMed for Ehlers-Danlos syndrome and GI symptoms, GI pain, let's say. And it will give you abstracts for what research has been done about that. Find one that sounds as close to what you're experiencing. You can use Lonesome Doc to order the article for that and bring it to your appointment. You have your goal at the appointment that you want to discuss the GI pain that you're having. And here's an article to further educate your doctor and to back up what you're saying, that GI pain is common in EDS at the same time. If writing all of this stuff is really difficult for you, as I know it is for many of us, don't forget about DragonSpeak and other software that allows you to use voice to text. That's a great way to do it as well. But some of us are old-fashioned, so you can go to Walmart or Target and get an accordion file and keep your papers just like that. This is a picture of mine. So at the appointment, bring all of that data with you and the agenda. I don't mean the data of everything that's happened to you since you were born. You would need a crane to lift all of that to your appointment. I mean, what data is specific to what your goal is, for what that appointment is. Bring that agenda, any samples that you have. If you made a graph, this is the time to bring that too. Anything that's going to support the treatment option that you want to try, the image that you're trying to get, or an action that you want your doctor to do. If possible, bring a family member or a friend to that appointment as well. A second pair of eyes and ears is helpful because it's hard to remember everything that's said during that appointment. Take notes or even ask if you can record the appointment so that you can listen to it later. Be aware, though, of what laws are in your state because it's not allowed everywhere. Go ahead and bring written questions that you have for this doctor, but try to limit it just to a few. The appointment times are not very long, and so you don't want to go in there with 20 questions. And be as specific as you can when talking with the doctor about what symptoms you have, how often it happens, and what is happening to your ability to function. If I go into the doctor and say, I have headaches, it doesn't give the doctor a lot of information so that he or she can treat me. But if I say, in the last month, I have had 7 headaches, all on the back of my skull, right here. And the pain is stabbing, it goes above my eyes, it disrupts my sleep, and I'm having trouble driving because of it. Well, that gives the doctor a ton of information about what is my pain like, when am I having it, how is it affecting me. Be as specific as you can so that the doctor can better help you and understand what it is that you're experiencing. We do need to educate our doctors about EDS. When we do that, you want to say, I have Ehlers-Danlos syndrome. Instead of saying, I have EDS, until at least your doctor knows what EDS is. Because if you go in just saying, I have EDS, well, they may think that it's an eating disorder, something or other. Or some other, or erectile dysfunction is the other one we heard. Emotional disturbance syndrome is another one we heard. If we want them to know what our condition is, we need to use the actual name for it, Ehlers-Danlos syndrome. You can say Ehlers-Danlos syndrome, which is abbreviated EDS, but if they really don't know what Ehlers-Danlos syndrome is, keep saying Ehlers-Danlos syndrome, Ehlers-Danlos syndrome, Ehlers-Danlos syndrome every time that you're saying your condition. The repetition will get in there. Bring educational materials with you to that appointment, maybe peer-reviewed articles, maybe medical resource guides or brochures from NIH, from Ehlers-Danlos Society is another place. But know that your doctor can't read them at that appointment. They're just too short. Trust that if you chose a doctor who's willing to learn about EDS, that they will read that information on their own time. This is where brochures are found on the Ehlers-Danlos Society's website. The second link is where the medical articles that were published in March of 2017 are located, everything from the new nosology and diagnostic criteria, as well as articles about how to treat or manage many of the symptoms that we have. At the appointment, remember that your doctors are experts of the human body, but you are the expert of you. You've lived in this body all your life. This is not the time that you're looking for validation. That's not really what the doctor is for. You're looking for some great problem solving. The focus of the appointment is on the information sharing and getting to solutions. And to do that, you're going to need to be a good time manager to make it all the way through to your appointment goal. But this is a bit key. We need to be open to trying different treatment options. And that can be so hard, I know, because we're the ones that have every side effect known to man. But if we say no to every treatment option that they offer, the doctor has no more options to help us. Part of having that good working relationship is being willing to try different treatment options. This is a great tip that I found through my primary care physician. She told me never book an appointment that's less than 30 minutes long. A little secret is that many doctors now are having to do the 15-minute appointment model, yet every doctor preserves 1 or 2 spots a day for 30-minute or longer appointments. For those more complex patients, ask to have one of those appointments instead. It really helps to have more time during the appointment. If you set up an appointment for earlier in the day, you're going to spend less time in the waiting room. It won't be so behind. Make sure your pharmacy, you have one pharmacy for all of your prescriptions. In this day and age, it doesn't look good when you're going from pharmacy to pharmacy. We have more patient tips here about being honest about everything. If you can, as long as it's not an emergency, contact your insurance company prior to having testing or any procedures to get that pre-authorization. You will save yourself so many headaches. And more tips. Understand that the world of medicine may be more limited than we would like. There's only so much that the tests can show, the images. There's only so much help the prescriptions can provide, or even surgeries. Another one is knowing your HIPAA rights. Those are those privacy rights, as well as who can see your medical information and how you can correct your medical record if you don't agree with what the doctor wrote in your medical record. Make a point to thank your doctors, your nurses, and even the front desk staff. It's amazing the difference in care you get when you extend that courtesy to them. I have a friend that goes so far as to bake muffins and cookies and brings it to each of her appointments. They do not forget her, and they look forward to her arrival every single time. I'm not saying you have to do that, but I'm just saying more fun or more progress you get with honey. But I'm afraid there's a few don'ts also if you're a patient. It's not good if you badmouth the doctors to the doctor you're having the appointment with. They tend to be protective of those in their field. The only exception to this would be if your doctor referred you to the doctor you had a bad experience with, because they need to know that information, that the doctor they're referring patients to maybe isn't as helpful as they thought they were. Please be honest about what medications you're taking, if you're doing your PT exercises. Also, don't take it personally if the doctor wants to discuss health issues with you. A few more don'ts, I'm afraid. Have those reasonable expectations. Know that doctors can't solve every problem in one appointment. You may need subsequent appointments if you have lots and lots of problems that need to be solved. Don't expect the doctors to read the EDS articles during the appointment. But when you bring EDS information, bring medical journal articles or brochures from EDS organizations rather than copying Wikipedia or somebody's blog on the internet or a post on Facebook that you saw. It's not that that information isn't also correct, but many doctors don't respect the sources of that information. So if you're trying to create trust with that doctor, you want to bring in sources from where they get their information and trust. If you're at that appointment and that doctor is condescending and talking down to you, maybe that's not the good doctor for your team. If that doctor is disrespectful, maybe not a good doctor for your team, or not respectful of your time, maybe that doctor is not a good doctor for your medical team. Not all doctor-patient relationships work out. You may need to change doctors. But you know what? This goes for patients too. If you're disrespectful to the doctor, if you're condescending to the doctor, if you're unwilling to try any treatment, that's also a red flag that this relationship might not work out and you may need to change doctors. Sure.
What do you do if you're experiencing this, however, that's the only doctor in your area without literally having to travel out of the state? Do you have any tips on how to deal with this kind of situation?
When you're saying these kind of behaviors?
Right, or not necessarily maybe condescending, trying, but he's cut and dry. You have this solution. They're not knowledgeable about EDS. Okay, I get that.
Okay.
And a lot of other things going on with my daughter, but he's the only one we have to work with in that particular specialty. So we're kind of stuck. How can we learn to work with him better to try to get that relationship going? Because the choices trying to...
Because your choices are limited. I hear you.
Yeah. Out of state.
Right. I hear that, and that's a huge problem. My recommendation would be to... Sure. She's asking, what do you do when you have a doctor that is not a good fit for your team, but they are the only doctor within your state in that particular specialty? What do you do? My recommendation, if going out of state is not an option for you, is to focus on collecting the data that we talked about earlier. When you're collecting the data, if you're changing it into a graph that you can share that information with, when you're pairing that with maybe a brochure about EDS or a medical journal article about EDS, you're supporting what you are saying to that doctor. You're showing that doctor, this is a reality of what I'm experiencing. And you're presenting it as, I have this problem and would appreciate your help in working together to solve this problem. You take it to just the facts and keep emotion out of it, and present them with the facts that go towards your appointment goal. You may need to scale back to what your expectations are out of this doctor. if that's possible, you know. But maybe I can talk with you afterwards about it. We've got a lot of slides here, but I'd love to talk with you afterwards. Real quick, we're going to talk about hospitals and emergency rooms. It's important to know that the emergency room, their role is to stabilize you. It's not to figure out why you're having symptoms necessarily. It's to make you stable enough to send you back to your local doctor or to admit you upstairs. That is their complete goal. You need to go to that emergency room if you're having chest pain when you're vomiting or shortness of breath or sudden sharp abdominal pain. Maybe you've lost your vision or really sharp flank pain. It's right back here. Or you broke your bone and it's sticking out. That'd be another good ER visit, right? There are definitely times we need to go to the ER. But don't go to the ER if your symptoms can wait until you see your doctor. Or if you know what the problem is, but you're hoping they're going to give you pain medication. It would be great if your pain is really high and you could go to the ER and they would give you a break from it for a little while. But in this current climate, you will be flagged as drug seeking and get poorer care the next time you need to go to the ER. Don't go to the ER when your doctors have not been able to figure out what is causing your symptoms and you're just hoping and praying that Dr. House is working that night in the ER. It's not going to happen. And if you are well enough to post on Facebook, should I go to the ER? You probably don't need to go to the ER. What about those hospital stays we sometimes need? There's a lot of things to bring. Having a go bag would be a good idea, just in case. Also, if you can fit into that go bag, a family member or a friend, really important to get the care that you need in the hospital. And don't forget that paperwork, your insurance, your emergency contacts, the list of your doctors, so that the doctors in the hospital can contact them if needed. And don't forget your phone charger. It's important that we all know what the HIPAA laws cover. I encourage you to go to this website to learn about that. But remember to do regular health checkups too. EDS does not explain every symptom that we have. And to tell you the truth, we are at risk more than many others because we have a tendency to think that EDS is the cause for every pain or symptom we have. It's not. We need to see our doctors when a new symptom or a new pain happens. Remember those eye appointments, those regular checkups. Maybe your FNH or bone density tests are a good idea, or mammograms. Having EDS is not easy. I can tell you for true, it's not. But when we're educated about our conditions, and we build medical teams with doctors who are willing to help us, when you do the work to prepare for your appointments so that you can prove you need the treatment that you're seeking, you really can get the medical care that you deserve so that you can live the best life that you can. Thank you. I appreciate you spending the last